Papua New Guinea is battling a polio outbreak after being declared polio-free for 25 years. What we are seeing in Papua New Guinea is chronic under-immunization, decades of under-immunization. So these leaves our children absolutely vulnerable for any vaccine-preventable disease. And such a polio outbreak makes every child in Papua New Guinea at harm, in danger for polio. And polio is a disease which cannot be reversed. It is a dangerous disease, highly contagious. For UNICEF and government and partners, this is a national emergency. And so all hands are on deck. All partners are together. So what UNICEF and partners are doing is we've made sure that sufficient numbers of vaccine, 3 million doses, are in country, so every child under 10 can be vaccinated. I've met health workers who have slept at a health center overnight to make sure that those cold chain equipment, because remember, vaccines need to be stored in cold places, right? In a cold refrigerator. However, if there's no electricity, the refrigerator switches off to make sure that the inverter and the backup power supply kicks in when there is no electricity. So these health workers are the ones who travel distances, who speak to the mother and the father, who speak to the child who's actually getting vaccinated. And it's a sad situation. We underfund that very post.
So we convinced the guardians and the parents of these babies below the ages of 5 or infants with stories and diagrams and pictures of all these diseases that can kill their child. Especially with polio, we show the parents and the guardians past stories, past examples of people who suffered from polio. But with polio vaccination going on for so many years now, we have less patients with polio deformities or people suffering from polio. So they can tell and see that now parents don't see a lot of children with affected by polio, with paralysis, deformities, one leg small, one leg normal. So they can see, parents can see that the vaccines are working. Most parents are selling food to support them in their daily lives. Other parents are working, or they might not have a babysitter or someone to bring the child to the clinic. They have to take time off work. So we have all those challenges. Another challenge would be the safety.
So what does the health worker need? She needs a transport carrier that will help her take the vaccines in a cold equipment. She needs money for fuel and maybe some food. So we have made sure that they've got all that equipment. What is missing is fuel money. And that little money is the reason many of these planned mobile or outreaches don't happen. Support your health worker, recognize their partnership, recognize the role they play, and make sure that they get supported, they are secure, they are able to travel far and give vaccines to children. Everybody under 10 needs to be immunized, and ensure your health worker is able to reach every child in your district, in your province, and every child in Papua New Guinea. Partnership is going to be very critical for addressing the polio outbreak, because all partners need to come together, ensure not only in terms of funding resources, but commitment, advocacy, to make sure we have a laser, unwavering focus. Because if we don't get 95% vaccine coverage, if we don't make sure children are immunized, then it's no use. Because we'll still have a reservoir of virus and children will be still susceptible. So it's important for everybody to lend their voice, their partnership at different levels to make sure we ensure in these 2 rounds of the polio campaign that our children receive the vaccine. Papua New Guinea is sitting on a gold mine of demographic dividend. We have 60% of our population is under 25. 43% is under 18, huge numbers. So this is something that needs investment. This is something that needs to be nurtured, protected, because this is going to really reap resources for our present and the future, not only for Papua New Guinea, not only for the Pacific, but for the world. And in this 50th year, let's make a promise to protect every child in Papua New Guinea.